Namaskar dosto. I am Purnima from Fertility Dost and I welcome you all once again at this very special session. Yes, once again we have a topic related to age, related to female fertility, and interestingly, during our conversation, we will discuss about male infertility and age. हर बार ऐसा नहीं है कि if we are talking about females then fertility and age is the factor. Even males can be discussed. So today we'll discuss age in concern to fertility in concern to males and females both. So viewers, if you have any questions related to age and fertility, like how does age affects fertility, then please start pouring your queries in our comment box. And if you are not on Facebook, then you can just send us a message on our official number, or we are live on YouTube also. You can share your queries through YouTube. You just stay full on this session and just hear the important pointers from our guest doctor and just think about it if you really need to focus on your fertility regarding to age. If yes, then this is the session for you. And to discuss this very important topic, that how does age affects fertility, we have very senior doctor with us from Bangalore. We have a senior doctor from Bangalore, Khushi IVF Fertility. So let's call our doctor on the main screen and start with the session. And viewers, if you have any issues, while if you want to just don't want your name to be seen on the main screen of Facebook, then please send us a message on our official WhatsApp number. Namaskar, Dr. Vinutha. Welcome to Fertility Dost.
Namaskar, Namaskar. This is Purnima. Thank you.
So, viewers, today we have very senior doctor with us, Dr. Vinutha. She's from Khushi Fertility and IVF Centre, Bangalore. Earlier, also, we have Dr. Rashmi from Khushi Fertility with us for a session. And we have many success stories to share, to discuss through Khushi Fertility. Viewers, today we'll discuss about this main topic, age. We all know that age affects us, but is it really so? We know that we cannot reverse our age, but is it possible to reverse the effect of age on a reproductive system? This and many other doubts, suggestions, we just want to discuss each and everything related to age and fertility with Dr. Vinutha. She has a very, we can say that she has very good results with fertility those members, and along with Khushi Fertility we have very success stories, many success stories which we can discuss, and the list will just go on. So Dr. Vinutha, let's start with the session and with the main topic, how does age affects fertility? We all know that when we just strike the clock at 35, there's some kind of tension, there's some kind of stress, that what next. So is it really so that age affects our fertility?
Yeah, definitely. Age affects our fertility because fertility is related to age. And in today's society, we have seen that infertility is becoming on a rise because of various reasons, like women are more career oriented because of education, and also like they're delaying their marriage, and uh, and also the motherhood. So that is the reason we are seeing more and more women are coming in 40s for fertility treatment. So why age affects infertility? Because basically, we have to go back to our biological clock. We have to remember women's biological clock, because all women are born with certain amount of eggs. See, this is physiological and it is genetically predetermined. So when she is born, maybe around a few millions of eggs are there in the ovaries, and by the time she reaches her puberty, there are around a few lakhs. So from the time she's born to puberty, there are so many eggs which are depleted and which are wasted. So this is more physiological. Then once she reaches her reproductive, that is once she gets a puberty, after that her that is the best period. That is around 20 to 30 years is the best period that she can conceive. That is a ideal period that she has to conceive. So once she attains a period, every month few eggs are depleted, maybe around thousands eggs are depleted. And by the time she reaches her 30, that is 30 plus years of age, there is a decline in the fertility, and more so there is a rapid decline after 35 years. And by 40 years the decline is more. So that is the reason. Why do I say this? Because when you take a woman at the age of 30 years, when she tries to conceive, she has 30% chance of getting pregnant in a single cycle. But when you take a woman at 40 years of age, that 30% falls down to 5%. So that is the reason I strongly say that age affects fertility. And I've just spoken about the women. Even male also have the similar problem, but though it is not so rapid, men also start having their fall in fertility by the age of 40 years, but it is at a slower pace. So even yeah, that's the reason I say for both male and female, age is an important factor.
Right. And again, if you are thinking or if you are planning your family and you are just nearing 35, 36, then we would suggest that please think of it on a much faster pace, because biological clock is ticking. Your ovaries are also aging along with your age. Dr. Vinuta, usually nowadays we have a good variation in AMH values. Even the ladies in late 20s, they are also suffering from this low ovarian reserve or very low values of AMH. What could be the reason for this, and any special kind of treatment according to you for such ladies who are suffering from low AMH?
Yeah, first, let's talk about what is AMH. AMH means anti-Mullerian hormone. So it basically reflects the amount of ovarian reserve that a woman has in the ovary. So this is a blood test that is which is done in various methods. So what I feel is AMH can go wrong if it is not taken in a taken the blood is not taken properly and it is not transported to the lab properly. So there could be variation in the lab to lab also. So what I believe is it is just a number, that's all. But if the AMH is low, I do call the patient on the second day of the menses to know what is their baseline follicular reserve. So what I believe is seeing is believing. So when I do a scan, when I put a probe, vaginal probe into the vagina, into the women's vagina, which is at high frequency, which is more close to the ovary. So I have a better vision of the ovaries, whether they are small in volume, how do they look, and whether how many follicles are there. So that gives me a better picture. So I suggest that women should not get panic when the AMH is low. They have to consult a proper fertility specialist. Also, there could be various reasons why AMH can be low. Even at 20 years, there are so many conditions where AMH can be low, especially something called as a premature ovarian failure, where a woman has a normal pool, but she will be depleting the reserve very fast. And in
Okay.
another situation where the pool may be small, but it will be depleting at a normal range. So these two problems can be there. And there's one more reason where if she has undergone or if she has undergone chemotherapy, radiotherapy. So these are the few reasons where the AMH level can be low. So such women should not panic, and I would say like coming to numbers, because women are more familiar with numbers. So I would say anywhere between 2 to 4 is normal, and 1 to 2 is reduced AMH, and less than 1 is more poor reserve, and above 4 they are what we say is they can respond, they can hyper respond.
Right. So, Dr. Vinita, is it really possible that AMH falls very rapidly? Because at times we have seen cases where ladies discuss that last month the values are more than one, and after a month, or we can say within a month, it just less than one. So, is it really possible that in normal circumstances the values reduced at one go? Or it's just a kind of myth?
Generally, what they say, the rate of decline of AMH for less than 35 years, they say they can decline up to 0.1 per year. It is per year. And after 35 years, it falls, the rate of decline of AMH is zero point 0.1 nanogram. So generally, I told you if they have associated with any other disease, like endometriosis is the most horrible. I mean, I can tell you most serious disease where it can affect the AMH value. So I would suggest all women who undergo any surgeries, ovarian surgery, should check their AMH before going surgery, before doing any surgery, so that we can take meticulous precautions when doing surgery, that so that the ovarian stroma is preserved, only the cysts are removed. So that's the reason it's very important to do an AMH level before any surgeries.
Right. So, as doctor just mentioned about endometriosis, and we think there are many cases today. We are seeing many women suffering from endometriosis. So, viewers, if you are having endometriotic cyst or such any such condition, then please take a note that you really need to think fast about your ovaries, because endometriosis is the main cause for depletion, or we can say that drastic fall of AMH. Dr. Vinuta, what you suggest for such females if they have less than one AMH values? Usually, people panic and they thought that donor cycle is the only option for me. So, what do you suggest? Like, what are the new technologies or new procedures which can help such ladies?
So if I mean, I would on and generally what I would tell women is, if they are less than 35 and their AMH level is normal, if they're not planning pregnancy in near future, I would ask them to do their AMH level at least yearly once to see where they're heading to. And if they're above 35 years and if the AMH level is low, then that means that it's an alert, it's an alarm, like it's an alarm saying that they should take treatment, and they should consult a fertility specialist and see where they're standing. That means they should go in a process of treatment. That means they should consider pregnancy and not postpone pregnancy. So if the AMH is low, then that doesn't mean that she's unable to conceive. It just says that if we do a scan on the day two, if we find two ovaries I mean two follicles on either side, there are medications, newer medications where we can give them, which gives good follicles and mature follicles, for follicles, and we have seen pregnancies in such women also. So there is no need to panic, but again, there is nothing that they should relax or anything, but they should go ahead and take further treatment.
Right. Doctor, as we have many new procedures, as a doctor, you must be doing new procedures, and the very new in this term we can say is uh, egg freezing. So,
Mhm.
what is the right age to freeze eggs? Embryo freezing, we know that it's really common, and whenever we go for IVF cycles, so usually nowadays we prefer doing FETs. But if
Yes.
we are planning something else and we are not planning our family, so what could be the right age to freeze eggs?
There's nothing like a right age or anything, but generally what it is said is egg freezing is done for women who had cancers, who has cancers, and who's undergoing any chemotherapy or radiotherapy. So such women are ideal women for egg freezing. And also, this is not a simple job because it also involves expense, and we don't know what how much of the eggs can be freezed. can retrieve, and also how many we, when once we thaw the eggs, how much will come back to we get good quality, we are not sure about it. So it is not on a regular basis, they should not freeze egg. Only women who are undergoing any other treatment for any other diseases, those are the ideal person who have to undergo for egg freezing.
If you are planning to freeze your eggs, then better to contact or connect with the fertility center so that doctors will suggest you the procedure, and whatever doubts you have, that could be cleared easily. Dr. Vinutha, very common thing usually nowadays we hear is PRP treatment. So many people says that okay, it's fine, let's do it, and many have their own doubts regarding this. So one is that is PRP treatment safe?
Is it for ovarian poor, ovarian reserve you're asking, or what is it? What is it they're
Yes,
asking?
I think for ovarian poor ovarian reserve only.
Yeah, there are not much studies for PRP treatment to ovaries because it is just a removal of the platelet from your own blood and which is injected into the ovary. So there is not much research or studies which support PRP treatment. But what is experimental going on is you can do a bone marrow, you can extract the bone marrow and inject stem cell into the ovaries. So that is more, what to say, more promising than PRP treatment.
Okay, and what about the cost factor for this and
So PRP
time?
doesn't PRP
And
doesn't need doesn't need much cost. It is the same autologous blood. We take the blood of the women, and it just needs some time, half an hour to 45 minutes, whereas we centrifuge the blood and we take only the supernatant, where the platelet is taken in a needle and injected into the ovaries. So that doesn't cost much. But bone marrow stem cell has more is more expensive.
okay, and we need to take proper test before going to this stem cell therapy.
Yeah, we
Any
have to. Yes, same thing. Like we have to proper diagnosis has to be made whether she has got a low AMH, and maybe around among 100 women, maybe only 30 to 40% can respond. So it's not 100% that the women will respond with stem cell therapy.
okay, so we can say that this stem cell therapy is still on a research way,
Yeah, experimental way. Yeah.
experimental way, right? So, doctor, we'll take one query over here. I'm 30 years old, unmarried. My AMH is 2. Not planning kids for 5 more years. Should I freeze my eggs or it is normal to plan after 5 years?
I would say like she's 30 years, and that's what I was saying earlier that she has to check every year and check her AMH. If it is on the falling trend, I would suggest, but the best idea is to plan pregnancy because natural way is more feasible, like than going through all this because it's not easy as people think. Uh, when we retrieve eggs, we may not have good qualities, and when we thaw and again we may not retrieve good oocytes also. So the best thing is to, if she's not planning pregnancy for another 5 more years, then I think I would ask her to every year let her check her AMH value and see if it is on the falling trend. I think she needs to take necessary actions.
Okay. And doctor, like you just mentioned that you will tell her to check her AMH if it is on the falling trend. So, what exactly is this falling trend?
No, as I told you, 2 to 4 is optimal. She's in the
Right.
optimal. She's in the optimal group. So if it is less than one, towards her poor ovarian reserve. So when do we call it as
Doctor, we lost your voice. Hello, can you hear me? Dr. Vinutha, can you hear me? Viewers, please let me know in the comment section if you can hear me or doctor properly. I think there's some network issues at doctor's end. There's okay. Okay, there's some network issues. Uh, yes, can you hear me? Okay, that's good. And can you see me also on the screen so that I should know that my network is good? Okay, so let's wait for the doctor to join again. Okay, thank you. So, viewers, we were discussing about the effect of age on fertility, and it's a proven fact that yes, age affects our fertility. And if we are nearing 35, then we really have to rush the things. But again, there are many new technologies, many new many new procedures which can help you deal with this. Nowadays doctors are also focusing on natural cycles, low stimulation IVF, which some doctors refer as mini IVF, and even regular stimulation of ovaries, so that we call it as embryo pooling. So we have many options where we can easily deal with this low AMH, or we can say that poor ovarian reserve. If you are having any such condition, then please don't worry about this. We know that it's really bad to see your report and when the AMH level is mentioned less than 1, then we thought, oh god, what next? But don't worry, new technologies, new things are coming up. But again, right, how to rejuvenate ovaries? Ovaries can be rejuvenated through exercises, and for this rejuvenation we particularly focus on fertility yoga. That usually people ask that why fertility yoga, because in fertility yoga we just focus on the strengthening of your uterus muscles and rejuvenation of ovaries. So, when we do pelvic asanas, lower abdomen asanas, they automatically the blood flow to your reproductive system increase, and this increased blood flow is the only reason for rejuvenation. So should we? Yes, doctor is here. And viewers, we have another session tomorrow, Zoom session that is related to meditation. As so, I'll explain this session later. Let's call Dr. Vinutha on the main screen.
Yeah,
Yes,
sorry,
doctor.
network issue. Sorry about it.
No, no worries. I thought my network is bad, so I was asking from the viewers.
Mhm.
Doctor, we were discussing about that
Mm,
falling trend of AMH levels.
exactly.
So, how to check this? Like, what do you suggest that once in a month we should go and check our AMH level, or after every 6 months?
No, as I told you earlier, like they fall at the rate of zero point 0.2 nanogram per year, per ml per year.
Okay.
So no need to check every month. I think once in a year is sufficient enough. So if the AMH is the same, like if two, it remains at two only. I think she can do every year. She can do a check, and if the AMH is falling like below two, nearing to one, then that's the time I think it's an alert. Like she needs to think about it. I would always suggest it's better to go in a natural way. I think we should not what is physiological, what is natural. I know women are very busy, career oriented, and all those things. But it's important that we should take care of it. At the same time, we should not over depend too much on the technology. So we should use it when it is actually required. So that's the reason I would say she can check every year and then consider freezing her oocyte if it is further delaying her manage. Because
Right. So,
even what I say is even now, even if she has to freeze her oocyte, it's not a easy job. She has to take at least 10 injections per day. She has to go, and it is more not responsible because here it's in a normal cycle. What happens? One follicle is formed. In When we want to oocyte, freeze the oocyte, we want as much as maximum follicle as much as required. So we'll be giving her more hormonal injections. So more hormonal injection, daily visit to the hospital, daily pricks, and again at least and under anesthesia, these eggs have to be removed. So she has to go through all this, and also it involves expense also. So I think um, she has to consider the pros and cons of egg freezing and then think about the future.
right. So, as just Dr. Vinuta suggested, natural way is the best, and if it just take a few minutes, or we can say that right decision at right time. So, natural pregnancy, natural conception is always best as we compare with IVF. But yes, again, if any medical concerns, then IVF is the possible way. Dr. Vinuta, nowadays we are hearing about embryo pooling. Is it really good decision when a lady is having low AMH?
Yeah, that is one of the option in women who are having low AMH because at times there are different waves of follicles coming. So one cycle may not be the same as the next cycle. So in such women where the ovarian reserve is less, we do give suggestion that they can go for embryo pooling. At times we can see that second cycle or third cycle they may have a better embryos coming up, I mean better oocytes coming up, and which can lead to better embryo quality. So that is one of the option for women with low MH.
And how many successive cycles of stimulation one woman can go for?
If the woman is having low AMH, I think she can we can do subsequent 2 cycles, and if we have enough embryos, then I don't think we have to subject her to again anesthesia and hormonal injections. So two is good enough. So by then we'll get to know how the quality of the eggs are, how the embryos are forming. Uh, so two is good enough for a woman who have low AMH.
Right. And again, if your AMH is less than 1, then embryo pooling is a very good option for you. So, doctor, we'll take another query over here.
Mm.
My age is 31 and my AMH is 0.24. Can I conceive naturally?
Yeah, definitely. If you don't have any other, that's what I told you earlier. Also, AMH doesn't mean that you're unable. AMH low AMH doesn't mean that you're unable to conceive naturally. If you don't have any other associated factors, like if you don't have any tubal problem, you don't have any fibroid, polyp, or endometriosis, and if your husband's semen parameter is normal, then you can definitely conceive normally. But only the chance of conception decreases when you compare to women who are younger with a good AMH value. But you should not get disheartened. You can try naturally. There is chances that you might conceive. One more thing is there are medication which can be given to you, which can increase the sensitivity of the follicles to produce eggs. And I would say in your situation, you're 31 years with the AMH of zero point 0.2, that compared to women who are 40 years and AMH of zero point 0.2, so you stand in a better chance because as you age more and the AMH level falls, even not only the number of eggs goes down, even the quality of egg also is reduced. So if your tubes are okay, the semen parameter is okay, I think you can try for few more months to conceive naturally.
Right, but again, please set a timeline or parameters for yourself because we really don't want you to lose this precious time. So, doctor, we have another question related to PRP. So, let me share this. I did PRP treatment before IVF, but my IVF failed. So, should I do it again before my next IVF cycle?
I don't know what she means by IV. I mean, is it an endometrial PRP? Whether she was the braided rich plasma instilled into endometrium, that we need to look. And also we have to see whether there was an implantation failure, what she's talking about. So implantation failure could be to various reasons. That is, there should be an embryo and endometrial crosstalk. So there are various reasons for the failure of implantation. It could be the lining of the endometrium, or it could be whether antibodies in place, there is a decrease in endometrium. So PRP may not be the only solution for such women. So we have to see, go back to her history, go back to her the initial stages when the what endometrium was prepared. We have to look into all the medications and other reasons for her for the failed IVF. So if once time PRP is failed, I think it's high time that other doses again has failed, not getting the same treatment again.
Dr. Vinutha, your network is really, uh, it's, your voice is not clear actually in between. I think some major network issues. So, uh,
Yeah.
doctor, usually when we have, there are conditions of low ovarian reserve. There are conditions when we are nowadays we are saying that women in late 20s also are suffering from low AMH and all that. At times, doctor mentioned the statement that you are nearing menopause. So, what exactly it means, and the lady who is still planning her family, is it the alarming bell for her when doctor mentioned that you are nearing menopause?
So, I mean, we should know when in Indian women, menopause occurs around 2051 years, and fertility potential will decrease about 5 to 10 years before she attains menopause. So, I mean, everywhere 35 is, I feel 35 is one, that is a magic number they have to keep in mind, and be more vigilant, and take enough precautions, and also uh, think seriously about having a child.
So I think we can say that there are few factors which you should consider when you are planning your family. Low AMH, obviously, you need to think again and again, but please don't panic. There are many medical procedures, and we have very good fertility centers in our country where you can get your treatment, timely treatment, and do egg freezing or embryo freezing so that you can use those embryos or eggs when you really plan a family. Dr. Vinuta, I think now network is fine. Now I
Yeah.
can see you.
Yeah. Okay.
That's good. That's good. So I'll take few queries. Okay. Can we have green tea at the time of IVF injections? We have this query from
I don't
a
think there is any contraindication to have green tea during IVF injection. As far as I know, green tea has some amount of caffeine. I think caffeine related some ingredient. I think that should not cause any problem. But only thing, anything should be in limitation. So don't overdo anything. Maybe 1 or 2 cups of green tea should be fine. So basically, they say it has some antioxidants. Fine, that should be fine.
So again, as the doctor suggested, don't overdo the things. That is really important. Doctor, we have one query from our YouTube user. Her age is 45.
Mhm.
Um, and now she has lost her child, and now she wants to go ahead with one more pregnancy, but doctor said that donor egg is the only possibility,
Mhm.
and she's saying that, asking that what could be the success rate with donor egg, and her husband reports is normal, that is 88 million count, and mortality is 80%.
So if she is opting for donor egg, I think the age of 46, usually after 45 years, almost your fertility career is almost nearing to end. So I think the best option is donor egg only. Yeah, the success rate is quite good because donors are the one who are not infertile. So we select donors who are fertile, and there are, according to the guidelines, there are certain rules and regulations how we select the donors. They should be between 25 to 35 years, and at least they should have had one children. That proves that they are fertile. So when the donor is selected cautiously and meticulously, and we do a day two scan to see how their reserve is. Depending on that donor, if the egg quality is very good, I think she has a good chance of having a good embryo and subsequently pregnancy.
Right. If you are planning your donor cycle, then we would suggest that please go ahead, and this time you may get success. Dr. Vinutha, we discussed about low AMH and we discussed about low ovarian reserve also. Any parting note for our viewers that how to deal with this age and fertility?
Yeah, so we talk so much about AMH. I think looking at the numbers, I think we should not panic. We should consult a fertility specialist. And I've seen many of them with point 0.1 AMH, they have conceived. So we are not gods. There is something beyond medicine also. Miracles can happen. So people should not panic, but at the same time, they should not take it easy also. So you should take right suggestion from the right people at the right time. Thank you.
Right, right. And I think this is really a nice parting note from Dr. Vinutha. Please don't hesitate to visit the good doctor at right time, right age. And viewers, if you are from Bangalore, in and around Bangalore, please do visit Khushi Fertility and seek your treatment options from there. We have very good success rate from Khushi Fertility Center, and this whole session we Khushi Fertility Center is contributing a lot, we can say, in fertility area, because they are using new technologies and new procedures, and again the staff is really friendly, and uh, from I think we yes, we have taken up the queries. So thank you, Dr. Vinita. Thank you so much for joining us today. There was some network issues in between,
Yeah,
but again, we have completed the session
yeah.
successfully. Thank you,
Thank you
Dr.
so much. Yeah, thank you so much. It was nice interacting with you. Thank you once again.
Thank you, ma'am. So, viewers, tomorrow we have a very interesting meditation session. Please do join a Zoom session at 6:30, 6:30 to 7:30. Tomorrow we have Guru Purnima. On this occasion, we emphasize on doing meditation, positive manifestations with your partner. So please join. It's a Zoom session. Just inquire on our social media, YouTube पे या आप इंस्टा पे, फेसबुक पे, कहीं पे भी you can see the whole creative of tomorrow's session. To join and do the meditation with our expert, and yes, take the blessings of full moon night. Thank you, viewers. Thank you so much for joining today's session. Thank you. Have a nice day.